Clockwork from our studio, IKD 106.1 FM. It's exactly 5 minutes past the hour of 11. A very good way this morning to welcome you to the issues where we talk about matters that concerns our nation, where we talk about matters that concerns every individual out there. You know how we do it every Thursdays. It's a special edition that has been set aside for healthy conversations. Every Thursday on the issues, we partner with General Hospital Ikorodu to talk about matters that concerns our health. Health, they say, of course, is wealth. And today, again, we would have the opportunity of learning from a medical practitioner that we have in the studio today. Specifically for every man out there, this conversation might be of interest to you. That means you need to stay glued to your radio set. For every man out there, of course, the women can also join this conversation. You could be a part of this conversation because I believe that women would end up having a man. If not, you have had that already. Today on the issues, we will talk about the causes of male factor infertility. Talking about this male factor infertility, there are cases where we hear that a man is unable to produce children or child. This will be our conversation today on the issues where we learn why is it so? Why do we have cases where men cannot produce children regardless of the unprotected sexual intercourse that comes up between a man and a woman? Some men find it difficult to bear children. Today on the issues, I have a doctor from General Hospital in person of Dr. Odutola Oyewo. She is a consultant, urologist, and of course, she's a trained medical practitioner. I remain your very own Opeyemi Adebambo. I'll be your host today on the issues, and you can be a part of this broadcast from anywhere all over the world by joining us on Facebook, IKD 1061 FM, where we're currently streaming this broadcast live. Today, again, I said we will discuss causes of male factor infertility. You might want to ask the question, why is it difficult for some men to bear children? Why do men not have the opportunity? Some of these men. This conversation this morning will go on for the next 45 minutes. And of course, you'll be privileged to ask questions from our trained doctor, Dr. Odutola Oyewo, a consultant from General Hospital Ikorodu. The studio lines are still very much active. 0904-081-1061 or 0904-082-1061. Good morning to you, doctor.
Good morning, everybody.
Thank you for joining us this morning.
My pleasure.
And let me say compliments of the season. It's a new year, actually. I've not seen you this year, have I?
No, we haven't met.
So happy new year to you.
Thank you very much, sir.
So today we want to talk about causes of male factor infertility. And you being a doctor, you know your onion so well. You'll be able to do a proper definition or description of when we say male factor infertility. How best, in a layman's language, can you define this problem called male factor infertility?
Okay, yes. So just to be clear, infertility is the inability or difficulty of a cohabiting couple who are having regular, unprotected vaginal intercourse at least 3 times a week, being aware of the spouse's fertile period, doing that over at least a year and still being unable to achieve conception. Okay, it's when we can now think, okay, there may be an issue. Let's have evaluation. So we have male factors, we have female factors that can contribute to this inability to achieve pregnancy. So because I'm a urologist, I care for the males who may have correctable factors that may have contributed to their inability to achieve pregnancy.
So yes, thank you. The essence of this conversation today is for our listeners out there to have an understanding of some of these causes, and then probably how it can be totally flushed away. But then I am curious to ask, when we talk about this male factor infertility, like you said, there is a male factor and we have the female factor. But when we say infertility, is it the same as the female infertility as well? Are there similarities between the male factor infertility and the female factor infertility?
All right, thank you. So for a child to be conceived, you need a healthy sperm from the man, a healthy egg from the woman. That you meet at the right time where the condition is good for the womb of the woman to, be fertilized with that egg. So it's multifactorial. All right. So it's not one person's problem.
Okay.
The evaluation should be of both couples. So even if a man comes to me today, I'm interested in, his wife's gynecological state. I'm interested in the wife's factor, as it were, as we are looking for correctable male factors that may have contributed to their inability to achieve pregnancy as a couple. So we don't want to lose sight of the fact that two play the game. The child is not created by just the man or just the woman's egg. So the two of them need to meet when they are supposed to meet, and the conditions have to be good for the germination of the egg to achieve pregnancy that everybody will see and celebrate
and say congratulations.
Yes.
So today we will focus on the male gender.
Yes, the male.
Let's do the male gender. Now you said something earlier, and I would like for us to have a proper clarification and understanding on that. When exactly is a man supposed to start getting worried, so to say, that okay, what is going on? I have not heard anything, I've not seen anything, I'm not seeing her through up. You were saying something about maybe if from 1 year. When exactly should a man start getting worried that something is wrong somewhere?
Okay, that question is it's a little bit difficult to answer in a black and white manner, because different people come to you with these infertility issues, different social circumstances. So when we see a couple, that's a man who has come now, not all of them are married when they come to the hospital. Some people want to impregnate their girlfriend before they marry her. Others marry and then they are seeking for the fruit of the womb, as it were. However, when you've got a couple who present to the hospital, one of the things we need to check to be sure that they're actually candidates that should have reasons to worry are: one, they should be cohabiting. But lifestyle of the times now, husband is working in Lekki, he's living in Ikorodu.
Exactly.
He comes on weekends. So they may not be actually having enough contact together. So we need to establish that they are cohabiting and they are meeting unprotected vaginal intercourse minimum 3 times a week.
Minimum 3 times a week.
And then have they also tried to time their meeting to the time the woman is ovulating? That's something many people are not aware of. Okay, so a husband should be interested in his wife's cycle. There are times when she's more fertile than other during the month. So it's information two of them need to have, and then when it's close to her ovulation period, they arrange their affairs to meet more frequently in that period. So if we have been able to satisfy those 3 criteria, and they've been doing that for a year and a year plus, for a woman who is above 35 years of age, okay, for men seem to have no time limits.
Exactly.
90-year-old men can impregnate people, so as long as they can get it up. So for the woman's age is also a factor. Once she's above 35, we reduce that time to 6 months. Okay. After she gets married after 35, and within 6 months she's not gotten pregnant. But yes, we can begin to say, let's be proactive and investigate and evaluate. So we have to put those things into consideration before we now start looking for what is not missing. Okay. Some people are still having protected intercourse and they are wondering why they're not pregnant. I tell you. Some people are still used to using condoms and they are wondering why their spouse hasn't gotten pregnant. Other people are not meeting enough, either because of stress of work, distance between them and their spouse. Some people work in Ibadan and live in Lagos. Okay, so all those things need to be looked into before we now say, okay, you've tried the natural means, okay, and we've still not gotten a pregnancy, and then we can now start evaluation. And at the same time the man is being evaluated by the urologist, the wife should be seen by a gynecologist, and then we meet at the midline.
So it's not just a one-sided thing.
No, not at all.
Both sides matters.
Yes.
Well, I want us to go straight into the conversation this morning, talking about the causes to this infertility by men. There should be causes to this, and that is the reason why you're here today. After which we would also talk about how to treat this disease, if at all it gets to that point. So when we talk about causes, what are some of the causes that brings what we call the male factor infertility? I want to believe that there are causes to these. So what are some of the causes from your line of experience, your wealth of experience as a urologist? What are some of the causes?
Yes, thank you. So I think I would like to say something very important here.
Yes, please.
there are some causes that I would say are correctable. There are others that are not correctable. For example, we see a lot of men in their late teenage, young adulthood who are coming to the hospitals with history of, neglected, undescended testes. Okay, so at that time, the testes are either in an abnormal location, or they're very small, or they had scrotal pain as a child. They wasn't properly cared for. The testes has now become small in size, so they are not able to produce the enough hormones or even healthy sperm cells, to be able to create what they need to contribute to conception happening. So you have those congenital causes or those childhood causes, people who have had neglected scrotal pain or scrotal infection, that wasn't properly treated, so it heals, forms a scar, so the road where sperm should travel to join the ejaculate becomes obstructed. And then they now have what people call low sperm count or no sperm in their ejaculate, as it were, because of poorly treated infection, at some time in their life. Okay, people who have also had groin surgeries that were not properly done, hernias done by untrained people, could also tamper with the tube that carries sperm from the testes towards the penis. Okay, so you could have post-surgical causes of infertility. Men who have had poorly treated, let me just use gonorrhea for the air purposes. Something people will know. Yoruba people call it atosi. People who have had purulent discharge from their penis, painful urination that was not properly treated. If it heals, it could heal and obstruct the tube that sperm should travel. Okay, people who may have had trauma, who play contact sports, footballers, basketballers, who get hit in the groin, and they think, it's nothing. They just swell up a bit, and then they didn't get it looked at, and stuff
and they
like
feel
that.
It's gone.
Yes, and then of course lifestyle, multiple sexual partners, unprotected sexual intercourse, recurrent infection. It heals by scarring, also blocking the road where sperm should travel. And of course, abuse of alcohol, abuse of smoking, all those things are damaging to production of quality sperm. Some people have good count, but the most of it is dead, as it were. So all those things are factors. Some of them may be avoidable, others may not be avoidable. And then, of course, there are the familial causes. For some reason,
the commonest
people who you realize that if you look at their 3-4 lines down, only one child. So there are some genetic reasons why some people are unable to conceive, as it were.
I was going to ask, is it yes, I was going to ask, is it hereditary? Is it something that you could just say that the father really never bore children, he has just one? Is it something that is hereditary, like it could be in a family that this family, their men are not just always very fertile?
Yes, it's possible. It's a possibility.
Okay, you can be a part of this conversation by dropping your comments on Facebook, where we are currently streaming live this broadcast on Facebook, IKD 106.1 FM, where we talk about causes of male factor infertility. And with this discussion, we have in the studio our doctor from General Hospital Ikorodu, in person of Dr. Odutola Oyewo. She's a urologist, a consultant, and of course, she sure knows our onions well. Now, I would like for us to talk about, how we could make proper, should I use the word treatment? I don't know if that would be correct, because all of the causes differs. But before we even talk about measures at which one can actually tackle these causes, is it also true to say that the diet could be a reason? I was waiting to hear diet. I heard lifestyle, yes, very true. But the diet as well, is it something that could affect a man's fertility with a woman? Maybe the things a man eats, how he eats, when he eats, and what he eats.
Well, malnutrition definitely will affect the quality of sperm. But hunger, as it were, I don't think is known to deter a man from having an erection. Okay, but we're not talking about erection now, or the strength to be able to achieve penetration. We're talking about the quality of the sperm that is needed to fertilize that egg when the time is right to achieve conception. So our own role as urologists is to evaluate men, investigate them to find out correctable causes. There was something I missed out that was quite common. We call it varicocele. Okay,
can you help us break that down?
Yes, those are when we have veins around the testes that are that's soggy or they are lax. They have lost their tone such that oxygen and nutrients that should bathe the testes to produce healthy sperm is reduced. So the quality of sperm that such patients have is suboptimal, and that is one common correctable cause of male factor infertility. Okay, so men who have varicocele have also been known to successfully impregnate their wives. Okay, but for other men, when it is found, it's something that gives a chance of increasing the quality of semen that such a man may have. Okay, especially when there are associated symptoms such as reduced testicular size, pain, and of course the infertility with a decline in the sperm counts that is documented.
Okay, thank you very much. I would open the phone line shortly where you would have the opportunity to ask my guest today, Dr. Odutola Oyewo, questions as regards our conversation, causes of male factor infertility. Now, many a times, doctor, we see that for the young couples now, before they even decide to get married and stay together as one, as the faith would say it, most parents, religion, they're always concerned about what is his blood group, what's his genotype, how is he health-wise. But we don't see cases of them trying to be sure, is he very okay down there, can he actually reproduce and all. So I want to ask the question, doctor, that is there a way a man will know, are there signs that a man will see in himself and say, I might not be very fertile, maybe I might battle with infertility when I get married? Are there signs to a man's infertility?
You only label a man as infertile when he has tried unsuccessful. So for the men who have been keeping themselves to their wedding, or for the ones who have not been trying to impregnate somebody, it's difficult to label them as infertile. Okay, so if you've got a 25-year-old who is planning to get married and hasn't had sex before, there's no way of looking at him and saying he won't be able to impregnate a woman unless you check his semen. But again, getting semen from a man is not like drawing blood for blood level test or blood sugar test. It's going to need him to either ejaculate or masturbate. And culturally, anywhere in the world, those are things that one needs to be careful in discussing.
True.
Okay, so I'm not going to have my 18-year-old son who is thinking of marrying in 5 years' time now, get him to go and do his semen test because I want to know
if his
sperm is fine. It's not something that is done routinely without him having tried and seems to have some difficulty, and that means he can now give us some semen to check the quality and quantity of what he's producing on the male side. So other things one needs to look out for, okay, is about, does he have the male secondary sexual character? Does he look like a male?
Okay.
Does he sound like a male?
Okay.
Does he have breasts when he shouldn't have breasts? Some men have breasts when they shouldn't have breasts.
True.
Are their testicles really smaller than normal? Are they overweight? Okay, so those are things one may look at and may need you to see a physician about to evaluate with respect to fertility, as it were, but not whether you can, impregnate somebody. That can only be discussed after he has tried and has been unable,
and there
or
are no
has some
positive
difficulty
results
with, as it were. So looking at a young man, if I look at him clinically, or I may suspect there are some issues that warrant or suggest, hormones may be low here, or there may be testicular issues here. So we examine the hardware, as it were. Physically, is he overweight? Does he look like a man? Does he have male facial hairs? Does he sound like a man? Does he have breasts? Is the penis well developed? Okay, are the testicles where they're supposed to be? Are they of normal size? Those are things I
want us to thank you, doctor. I want us to talk about diagnosis, how one can quickly diagnose these things and be sure, just like you have rightly said, it is not something that you can just look at somebody and decide and say, he will not, he will. But before we even talk about that, one of the commonest beliefs is that when a man takes too much sugar, this is just by the side. I want you to help us clear the air on this one. They believe and say that a man that takes a lot of sugar might not be able to reproduce children or might face the issue that we're talking about today, infertility. How true is that? How dangerous is sugar to the system, the body system of a man, as regards our conversation?
Well, I used to think they said it was when a man takes too much sugar, he will have low back pain, so he won't be able to perform. Okay.
Yes, that we also used to hear that too.
So that we need to be sure we're asking now.
No, this time around
I'm not talking about ability to perform now. I'm talking about the ability not to shoot blanks. So when you ejaculate, is your ejaculate able to contribute to pregnancy? Okay, and again, that goes back to what we're talking about. The quality of semen determines whether it will be able to achieve conception if it is delivered in the right place at the right time, when there's a healthy egg waiting for it in a healthy womb, waiting to receive the two of them for fertilization to take place and the baby to develop going forward from there. So yes, obesity, diabetes, definitely can all affect the process of erection, and then of course ejaculation, and the quality of what is definitely going to be in the ejaculate. So yes, I guess too much of anything is bad, including sugar.
Now, before we go to diagnosis again, I would still like for us to come to the part. You said something earlier, it skipped my mind, but it's good I can recall now, when you said something about a woman being right at the when you meet a woman at the right time, that there are times for this. Not all men knows this, I can tell you for a fact. Then how do a man knows that, okay, this is the best time to meet with my wife, this is when I shoot my shot and be sure that something positive will come afterwards?
All right, so it's important for couples to understand their wife's menstrual cycle. So every woman's cycle is peculiar to her. Some have a 28-day cycle, some have a 30-day cycle, some have a 24-day cycle. So it's important. So day one of the cycle is the day the period starts. Okay, so I encourage my patients to study the cycle for about 2-3 months, so at least they are sure, when the next period is supposed to start, when the next one is supposed to start. So usually ovulation occurs mid-cycle. So if you are aware that your wife menstruates for every 28 days, you expect that on day 14 she should ovulate. That's to release an egg. But because we are not God and it's not going to be clockwork, these things are affected by things going on in her body and around her. You usually give a margin of 2 to 3 days before that 14th, 2 to 3 days after that 14th. So for that 6 to 7 days, I encourage my patients to meet more frequently. So you are unlikely to miss ovulation, even if it came earlier than you calculated, or if it came late than you calculated. So that's the advice I give them. So we expect ovulation to occur mid-cycle. But for you to know what mid-cycle is, at least you should have studied the woman's menstrual period for about a few months, so you understand when she's supposed to release an egg. For those women who have regular cycles. For those who have irregular cycles, it's a little difficult to time that. So that's why we encourage spontaneous, unprotected, frequent intercourse. There's no cap to it. As long as it's not going to hurt anybody, you can meet your spouse as often as you feel like. All right.
Yes, I would open my WhatsApp line, which is already made available now. If you want to ask questions, you have the opportunity of doing WhatsApp as well. That is 0904082161. You can send in your voice notes, voice messages to our WhatsApp line, or you can type your questions as regards our conversation, causes of male factor infertility, today on the issues here at IKD 106.1 FM. This is how we do it every Thursday from 11 up until 12 p.m. Talking about this male factor infertility, I want us to talk about the importance. How important is early diagnosis? How important is this? Because some people do not even see the importance of diagnosing if they are on this side or that side. Many a times we see people rush down to your kind of profession and say that I need help. Nothing is happening. This is 2-3 years after we got married, because they already see that maybe something is wrong. But let's talk about the early diagnosis. How important is this?
Well, early diagnosis, I won't say that really, is involved with infertility, because it's only when you have tried and you have issues you begin to think about it that way. So what we may talk about is for people to be self-aware about their weight, about their diet, about their lifestyle choices, smoking, alcohol, multiple sexual partners, and then proper treatment and early presentation if you have injury or infection involving your scrotum, your testis, or your penis. Early presentation to a urologist. Those are things that we can improve the outcome following such injuries or infection, so that we don't have such a situation down the line, presenting as difficulty in achieving pregnancy some years down the line. Because these people who we have had this purulent urethritis now, they would have had it several years ago. They've forgotten they even had it. It's when you are asking questions, they recollect, they had it so about 12-15 years ago. And they used that go, all right, but it was poorly treated. So the thing healed eventually, but it healed with a scar. That scar has narrowed where sperm should pass. So it becomes an issue now. They may eventually need assisted reproduction.
All right, thank you very much, Dr. Odutola Oyewo. Still on this conversation, the next 30 minutes, I want us to look at some positive and negative sides to this conversation. Earlier, you talked about some of these factors could be correctable, while some are non-correctable. It is very understandable when you say correctable. That is actually the positive side, that yes, we know that this thing will be correctable. But coming down to the non-correctable, like you use that word, when you say non-correctable as regards infertility in men, is this to say that we could have cases where a man might not be able to ever get a woman or the wife pregnant? Has there been any case like that where we know that this man might never be able to impregnate a woman? Is that what you meant when you said non-correctable cases?
Okay, so in medicine we never say never, so that's not what I meant.
Okay.
So when I say non-correctable causes, I mean things that I may not be able to do something for you as a urologist.
Okay.
As a man. For example, if someone had a fall and stride injury, he fell into a gutter, he landed with his groin on the edge of the gutter, he was bleeding, and then eventually he develops what we call a urethral stricture. And we now have to put a pipe in his belly for him to pass urine.
Yes.
So if urine is not passing from the penis, he's not going to be able to impregnate a woman from the tube in his stomach. Easy. No.
True.
So we have to re-establish the connection so he can urinate and ejaculate through the natural means. That is one correctable cause of infertility, for example.
Okay.
The varicocele, the dilated veins I mentioned to you before, is another correctable cause. Now, things that are not correctable, for example, if somebody has had bilateral, that's on two sides, the testis didn't come down to the scrotum. The boy was raised by his grandmother. She also didn't think there was anything wrong with it. She expected it to drop. It never dropped. And then the boy went abroad to stay with an auntie, and then he's 22 now. He wants to get married, and there's nothing in his scrotum. There are no testes in his scrotum. Okay, so we examine him. We find there are two seeds somewhere in his groin. All right, for that gentleman, for example, now I can't correct that because sperm that should come from his testes is it didn't develop well. Okay, so that's an example of non-correctable cause, as it were. For that gentleman, for example, now he will need assisted reproduction. okay, for him to have, or adoption for him to have a child of his own.
Let's accommodate questions. Let's take in questions. The phone lines are opened. 0904081161 or 0904082161, talking about causes of male factor infertility. One of the messages we have here on WhatsApp, this person is saying that in a case of a married couple, they had their first child and 7 years down the line they are still expecting another. Several tests according to them has been done, and they said they are fine. I'm trying to just rephrase this based on how this person placed it. They are fine. That is what doctors are saying. But 7 years down the line, nothing is going on. Can we also say that this is one of the male factor infertility, or what exactly is going on in this person's case? 7 years. It's not like as if they never had a child. They did have a child, but ever since they are yet to receive or bear another child. What can you say to this professionally?
Okay, so this situation is referred to as secondary infertility.
Okay.
We call it secondary infertility because they've been able to achieve conception that yielded a child, at some point in time, and then there seems to be some lag or delay, and so for that now, we can't say there's anything wrong with the husband or the wife because they've done it before. So if you've been able to have a child before, you should be able to have another child. So it will be very good to be clear about the details surrounding that last conception. Okay, for one to understand why it's taking so long. 7 years for them to have another conception. So if I don't have that information, I can't comment on why they've been unable to have another child. Okay, so maybe they need to see their gynecologist and the urologist again.
Definitely they can go down to General Hospital Ikorodu. Just ask of Dr. Odutola Oyewo. She'll be there to attend to you. She's a urologist, a trained one at that, I must tell you. So now let's look at the mental health. That is the emotional aspect. Could this also be another contributing factor to infertility in men? It is believed, or it is said, that men actually go through more of the stress in marriages, in many homes. They are the ones that wants to care for the family, they wants to provide financially, they want to ensure that there is subscription on their decoders. They are doing almost everything. Could this also be a factor, the mental stress, a man being drained mentally? Does it have to always be the health wise alone? Could the mental stress, the emotional trauma and all of that be a contributing factor to infertility in men?
Yeah, you're right. We need to appreciate and acknowledge all our men do for us. And on behalf of women, we say thank you very much. However, I think we also need to be clear, because a man who is worried that his container is on the high seas, or his business contract has not been approved, or his wife has asked for 10 million naira, he doesn't know how he's going to give her 10 million naira. All those things will affect hormonal imbalance and may affect erection, not necessarily spermatogenesis, that's development of sperm. Okay, so of course, if you cannot get it up, you can't complain that you're not impregnating your wife. So a man who is under pressure at work, waiting to meet a target or a deadline, who is worried about a business project he's trying to execute, is not likely going to be bothered about, sleeping with his wife. Yes. So that is how I think mental health may affect a man with respect to infertility, but not necessarily affecting the quality of his sperm, unless if he's on some medications for known mental health disorders that may affect sperm production, like lithium. Some people are on some mood stabilizers that can affect the quality of sperm. But those ones are men who are known to have some mental and behavioral disorders. Okay, so that's that.
Okay, let's look at some alternatives. We have just 15 minutes or thereabout before we will let you go today, but we want to say a very big thank you for helping us illuminate this conversation. But going further, let's look at some other options. It is always said, or it is believed, that when there is infertility in the picture of a marriage, there are options, there are alternatives. That's by the side. Before that, what should a man do first when he discovers that after 1 year, 2 years, there is nothing to write home about? We are not seeing the result of all of our sexual intercourse. Nothing is coming up. What is the best advice for a man? Immediately he sees that year 1, year 2, year 3 or more, and nothing is coming up. What should he do first?
Well, the first thing I can professionally advise any couple to do is to come to the hospital, seek consultation with the urologist for the male, with your wife in attendance, and for a gynecologist for the female evaluation with the husband in attendance. Okay, and then they will listen to you, they will examine you, and if necessary, request for some investigations and find out if there are any correctable causes of what is likely causing the inability to achieve pregnancy. And then once that is done, if those things are tried or the tests are done and there's still no production of a pregnancy, there's assisted reproduction. And if that fails, of course, adoption is the end game. That's the end of the line usually.
That's always the end of the line, adoption. So, okay. But when we say, anyways, that will be for maybe later on. 09040811061 or 09040821061. Now, we've said so much about this male factor infertility and then the things that could cause them. Now, let us come to the angle of the woman. I know our focus is for the man right now, but then we cannot overemphasize the importance of a woman too as well. Many a times when these things comes up, the stories we hear is the man, maybe he's not being able to this, or they will just tell you, go and try another woman that will make sure that you are the one that is fine. For a woman too, what should a woman do in a case where year 1, year 2 and nothing is coming up? What should a woman also do in that situation?
Well, like I said, we still need to come into the hospital. She needs to see a gynecologist.
Okay.
A gynecologist is the one that is trained to evaluate female factor infertility. Because this thing can be caused from a range of hormonal imbalance to the presence of fibroids, to the presence of the fact that she's overaged and no longer ovulating, or even that she has even stopped menstruating and she's not aware she has stopped menstruating. Okay, or she's had surgery before or infection before and the tubes are blocked. So there are different tests that they usually ask women to do to assess the genital tract to be sure that it can receive conception. And that's the area of the gynecologist.
Okay.
So the woman needs to come into the hospital and seek a gynecologist.
I think this will be my last question for today, and that will be on ART when we talk about the assisted reproductive technologies. Now let's look at available options for assisted reproductive technologies. What are some of these assisted reproductive technologies that one could look into as regards infertility in men? I think that is another very important thing we need to talk about today as regards this conversation.
So for the man, for a man who is unable to achieve penetration, for example, the option of artificial insemination,
okay,
is there, either from his ejaculate, or we take sperm from his epididymis or testis, and then in conjunction with the fertility consultants, we put them into the spouse. Okay, and of course there's a popular IVF everyone knows, as a form of assisted reproduction, but there are criteria to select each type of assisted reproduction based on the evaluation of what your tests have done. For example, I have some gentlemen patients who for some reason are unable to produce sperm even when they ejaculate. Those ones have some obstruction. So if we are going to get them assisted reproduction, we need to harvest the semen either from the testes or from the epididymis and introduce it to their spouse. Okay. And all these things are they're for select patients, okay, based on what your own evaluation talks about. There's even what do you call that now, the one where I'm trying to make it in a lay term now, where you take the sperm, you take the egg, you put them together, they form together, and then you take that and put into the wife. So for a woman who doesn't have a healthy uterus, of course that can't work. All right, so assisted reproduction is tailored to each couple's what deficiency they have.
It's peculiar.
We can step in and complement what they have to achieve pregnancy. And of course, people who cannot produce sperm even, or don't have sperm, like the person I mentioned that may not have developed testes, so they get donor sperm. You could also get donor egg. So all these things they're quite varied.
So let me ask, you saying this, it's sounding as if it's something very expensive to
it's not readily available in most government facilities. So, and of course the people with the skill and know-how are not as common as we have general practitioners. So there are people who have to be specially sought and evaluate them. And then of course none of all these things are also 100% certain.
True.
Okay, so all these things have to be properly discussed with the couple for them to select the one that works best for them.
Infertility is something that is very common. It's something that it's no stranger. We hear that these things are happening. But then, as regards what this particular man might be facing, might be different from this particular person. The situations are not always the same, as the case may be. That is to say that the treatments too might not be the same. Now let us look at this treatment. How is this treatment like for correctable situations or issues? How is the treatment always like? One thing that scares some men away is that when they see that these things are not coming, rather than for them to go to any nearby hospital, general hospital, they will just want to tell you, let me go trado, let me go traditional. That is when you hear the introduction of agbo and all of that. That might even cause more harm to the system. But when we talk about treatment of infertility in men, how is the process like? How affordable is it, and how visible is it for a man to be treated if discovered that there's something wrong here and here? As soon as you go through this treatment, you'll be fine. How affordable is that?
I want to quickly say something before I forget.
Yes, please.
Fertility is common, and it's going to become more common because many of our young men and women abuse alcohol and inhaled substances, and psychoactive substances. So we are seeing more and more young people with abnormal, sperm test results, small testes, and trauma to the groin, infection. So I would like to say this out there for us to be aware of our lifestyle and choices. Now, the treatment of infertility will be determined by the cause of infertility for each patient. No two patients are managed the same way. Everybody is managed based on his own merits and the peculiarities of his medical comorbidities. Somebody who is diabetic and also infertile will not be managed the same way as somebody who is not diabetic.
True.
And infertile. So everybody will be managed based on their own personal characteristics. So yes, most times it's affordable as long as you come to the right place. You haven't gone around and spent all your money on ST3 and all those other things on the airwaves and online that people are selling, that people buy and spend so much money on, and by the time they find their way to the hospitals, their pockets are almost dry. They are unable to do the requested investigations for you to know what the problem is, and then you can now know how to advise them on the options of treatment available to them in particular. And people have this mindset of this is what this person did, or this person had, or he used this and it was fine. Forgetting that you don't know that person's full story, you don't know his makeup, and you're not even sure what's wrong with him, in the first place. So those are the things I can say in response to that.
I am tempted to ask now, as regards this one coming in here. Then someone needs clarification on family planning and wants to know that how true is it that in some cases family planning could also be a problem when we talk about male factor infertility. Now, for instance, a family that after they had their first child, some people will just want to go through that family planning process and say that I want my first child to be 4 years older than my second, or 5 years and all. And then they undergo this family planning. There are several forms of family planning. And then after the so-called family planning, they see that there's a struggle to bear another child. Now, this person needs clarification that are there cases of family plannings that could later be a problem for a man and will bring about this infertility? Do we have issues like that? Have we ever had a story of a man actually had issues because he went through family planning with the wife?
If I'm correct, it's mostly the women that go through family planning, as it were. They're the ones that take the pills.
Yes.
They're the ones that take the injections. They're the ones that wear the IUCD, not the male. The males, usually, if they want to come for some form of contraception, they come to us, and what we do is called a vasectomy. Okay. And it's not a decision that is taken lightly, because most times it's not reversible. Okay, and the average African man is not likely to agree to that. It's just very few patients, that consider that maybe after their wife has had the children, it was turbulent in the last two, and the man says, please don't let me kill this woman. So he agrees to have his tubes tied off. Okay, so for most family planning, the woman is the one that usually takes the contraception. So I don't understand where that person is coming from, what he means. So what usually happens with the woman is that because most of them with the hormonal ones, for example, the pills, it now affects the cycle for the woman. So it takes some time after you stop it for the body to reset, to have a normal rhythm that can sustain what happened before. So that may cause some delay in quote. And if that happens, if she's a gynecologist, you need to go and see.
So definitely it's always from the end of the woman and not the man.
Based on what we said now about the contraception or family planning that is common in our environment, the woman is the one that usually takes the pills, takes the injections, wears the IUCD. Even female condom is not very common here. Male condom use is also not very well accepted among couples unless the two of them agree properly about it. So the contraception that can affect a male that I'm aware of, that is common here, is vasectomy. So when a man has done vasectomy, he should not be expecting.
Like it's the end of discussion.
That was the aim for him doing it. He didn't want to have more children. So it's a decision him and his wife must have come to. The other thing that can happen to a man that will prevent him from being able to bear children is when he has had prostate surgery. For men who have done prostate surgery, we tell them, if the Oba of your village gives you another wife, you will sleep with her, but tell her you cannot give her a child. Okay? Because prostate surgery, affects the flow, direction of semen. So it will flow into the bladder first before it comes out with urine. So you'll be shooting blanks. Okay, so contraception wise, for a man, no.
Dr. Odutala, you will want to say thank you so very much for your time again this year, taking your time to come enlighten us as regards our conversation today, causes of male factor infertility. Before you leave, what would be your parting words, your advice to everyone listening to you and watching you live on Facebook here? What would your advice be, especially to the male gender? What do you have to tell our listeners?
Well, I want to let people know that infertility is not a disease. There are correctable factors. Okay, it's only when you come to the hospital for proper evaluation we'll know which category you are. Okay, and it's always better to prevent, the uncorrectable factors if you can. So to our mothers and grandmothers out there, when children are born, take a look at their scrotum. They should have 2 testicles in it. When a child complains of scrotal penile pain, it should please be seen properly by a doctor and properly treated promptly, okay, so that they don't lose the testes or have infection that block passage of semen. And for our young ones, we need to be careful of our lifestyle and our sexual habits to keep ourselves healthy and make the tubes patent for eggs and sperm to pass when they want them to be passing to achieve conception. And I think with these few words of mine, I hope I've made a small difference. Thank you all.
Yes, we hope you've been able to convince and not confuse us that it is important for you to stay healthy. So I want to say thank you so very much, Dr. Odutola Oyewo, for your time. A consultant urologist all the way from General Hospital Ikorodu. This is how far we can have it today on the issues. But then, like I said earlier, please feel free anytime to walk into General Hospital Ikorodu and then just ask of Dr. Odutola Oyewo.
My clinics are Tuesdays only, please.
Tuesdays only. Okay, you've heard that from her. So just walk down to her. She's a urologist and she'll be able to attend to you in the right way. Again, we say thank you so very much for joining us today on The Issues.
Thank you for having
me. The Issues will continue tomorrow, same time, same station. My name remains the same, Okpeyemi Adebambo, urging you to stay healthy, live a good life, and remember that your health is wealth. God bless you.